And developing right now at the White House, President Obama is putting his focus back on health care this week. He's expected to speak any minute now from the Rose Garden, rallying doctors as his health care overhaul plan heads for a critical vote in the Senate Finance Committee this week. Let's get into it with NBC's chief White House correspondent and political director, Chuck Todd. So, Chuck, I understand about 50 doctors with the president. What's the big goal here?
Well, it's one from every state. And as you know, doctors, when people talk about their health care, the average American, the person they trust the most is their own doctor. So the hope here by the White House is if you have doctors, sort of the most trustworthy group in the healthcare debate, more so than insurance companies, more so than politicians, that it can help the credibility for the president to sell his plan. But let's be realistic. The big news today on healthcare is not going to come from this event and doctors. It's the number that's going to come out of the Congressional Budget Office, because that's what this White House is waiting to hear from, to see how their health care bill, the Max Baucus health care bill out of the Finance Committee, how will it get scored? And why does that matter? It matters in order for them to get Republican Olympia Snow's support. So that's really the drama around health care today. Behind the scenes, this doctors event is, of course, more of an attempt by the White House on the PR effort.
Well, but back to the doctors, Chuck, there was a recent poll of doctors who said that they, in the large numbers, support public option. So I'm curious, with that said, I don't know if any of those doctors who will be present were a part of it, but we still know that public option may be on life support, but it's out there. And when you look at the polling recently, doctors supported it.
There's a lot of doctors. I've interviewed doctors from all political spectrums over the years, and some of them are very supportive of single payer. The idea of, and one of the reasons, doctors, when they run their offices, spend a lot of money on administration costs. So anything that can cut down on that, that's their own bottom line. Doctors, they get fired up about two issues when you talk to them about. One is the amount of paperwork they have to fill out for various insurance companies, and then, of course, medical malpractice. So it's one of these odd coalitions. Doctors can be very supportive on single payer and at the same time be very pro about this idea of medical malpractice. So one thing that liberals love and one thing that conservatives love. So it's always been surprising to me how doctors haven't been able to become more of a mediator in this debate. But politically, they've never been a very strong organization, not nearly as strong as some of the other key players like the pharmaceutical industry and the insurance industry.
Great points there. All right, Chuck, thank you very much. And it brings us to our next part of this one. Is the president ignoring doctors who don't agree with him? And joining me now live, Dr. Donald Palmisano, the former head of the American Medical Association and clinical professor of surgery at Tulane University School of Medicine. Thank you so much for joining us.
Thank you, Monica. Privileged to be here.
It's actually Tamron, but Monica's with me too, and we both can talk to you. But Doctor, let me ask you, you were not, that's okay, come on. You were not invited to the White House today, and you've written an op-ed today titled, "What We Would Have Told Obama." You heard Chuck say that the doctors have not had a powerful voice to match, for example, the pharmaceutical industry. But what would you have told the president if you were there? We're looking at a live picture, by the way, of the Rose Garden, 50 doctors who are there.
Yeah. Well, thank you. I wrote that op-ed piece in the Wall Street Journal today with two other former presidents of the American Medical Association, Dr. Johnson and Dr. Plested. And what we're saying is that there are solutions to the problems that exist. There are some problems in the health delivery system, but we have the best medical care in the world. What we ought to do is get rid of this public option.
But we don't live as long as other places in the world. I mean, how do we measure being the best?
Well, there are a lot of differences about our lifestyle in America that are different from other places. The most important thing is that you don't see Americans going to other countries to get their aortic coronary bypass, their heart surgery, or their brain surgery. People come from other countries to America.
But we do have Americans who aren't getting health care, who, and the cases have been cited up and down, who are dying without the health care that they need, that is available to
everybody. Well, first of all, everybody gets emergency care under current federal law. If you go to an emergency room in an emergency, the hospital and the doctor is obligated to treat you for that emergency. But what we need to do is to focus on the problems and not change the entire system. Most people, the overwhelming majority of people, are pleased with their current health insurance. What we need to do is to help those people that pay too much because of all the burdensome regulations. Let them buy across state lines. Fix the broken medical liability system to get rid of the the defensive medicine.
Right.
Let's allow people to own their own insurance with health savings accounts. But the public option, we need to keep a stake in the heart of that thing and put that to rest. And when you go to other countries, I just got back from Australia, and what they're doing, they're encouraging people to buy private insurance, and they're giving them a 30% subsidy.
But doctor, let me ask you, I know you said that most people, and you're citing a poll there, are happy with their health care, meaning they're happy with their doctor, but I can counter that with polls saying that people, the majority, want public options. So why put a stake in the heart, as you put it, of one, but not the other, if we're going to play numbers here?
Okay, well, I would say you want a public option. There is the, let's take a real long standing program, Medicaid. All the people on Medicaid have insurance, but it doesn't do any good to have insurance if you can't find a doctor. They pay the doctors so little that the doctors say, I just can't afford to treat all the Medicaid patients, and that's not fair to the Medicaid patients. Let everybody who needs help get help, and let them have an array of choices. Is that novel? No, the Federal Employees Health Benefit Program is like that. We need to get less government in medicine and allow the patient to own the policy and let the doctor be the trusted advisor.
So let me ask you, let's bring it down so folks can understand this. With those, your colleagues in a sense, those doctors in their white jackets there in the Rose Garden with the president, what do you think would be the most important thing that could come out of this today, in your opinion?
Well, the most important thing is for everyone, the president and the people in Congress, to listen to all viewpoints. Let's all work together. It's like a scientific experiment. We already have some of these scientific experiment results. We got Maine, we got Tennessee, and these programs have been disasters there. Those are public programs, public options. Let's learn from that, and let's go back to things that work. Health savings accounts for the people who want that works very well. They become prudent purchasers. Let people own their own insurance. But what we need to do, don't rush. This would be like congressional malpractice. If I operate on a patient with an aneurysm, an abdominal, a ballooning of the aorta in the abdomen, and we didn't know exactly what was in there, we didn't know who was going to help, we didn't know if we had the graft. The Senate Finance Bill, nobody knows exactly what's in the Senate Finance Bill. Have you seen the words of it? How many pages is it? And the Congressional Budget Office is going to put a price tag on just the summary of the bill, the way I understand it. Let's do this very cautiously and appropriately. Let's do the right thing for the American patient. All
right, Dr. Palmisano, I certainly appreciate you joining us with your side of the conversation. It's a pleasure. Thank you.
And still ahead, two key Democrats threaten to throw up a roadblock as the Senate Finance Committee nears a critical vote on health care reform.
Plus, he's accused of stalking and